Start. Okay, so today we will discuss about the hypertension or the pharmacotherapy of hypertension, first part of it. Here the purpose of this presentation is to explain the how the blood pressure rises and which are the possible target sites of antihypertensive agent. For that, you have to first understand that blood pressure depends on which factors. Blood pressure depends on two factors. One is the cardiac output and second is the peripheral vascular resistance. Now, what is cardiac output? Cardiac output, it means the blood that is ejected out from the heart in 1 minute. And you all know that the blood that is ejected out with each contraction of heart is known as a stroke volume. So if you multiply stroke volume with the heart rate, then you will get cardiac output. Okay. So if any condition rises the cardiac output, there will be rise in blood pressure. And dear friends, you all know that this stroke volume and heart rate is increased whenever there is a sympathetic overactivity. So sympathetic overactivity is one of the reasons for rise in the blood pressure, and that's why it has been noticed that person who are having type A personality, it means that who are very anxious, stressful, taking stress in a very minor matters. These are all known as a type A personality individuals in which the chances of development of hypertension is more. And as compared to that, the person who are having type B personality, that is called happy-go-lucky personality, the development of the hypertension will be less. Okay, now we will not go into the detail because that is not our topic right now. But hypertension can be of many reasons. Okay, and the most common reason of the hypertension is, you will feel that sir is joking, but this is true. That is idiopathic. It means we don't know the cause. In more than 90% of the cases, we don't know the reason of the hypertension. And that's why it is called essential hypertension. And not only we don't know the reason, but we can't find out. There is no reason also there. So the only targeted approach is we have to control the blood pressure. Okay. In 10% of the cases, you will find some cause that is known as a secondary hypertension, where there is a renal cause or other endocrinological causes or tumor. In that case, you have to find out the cause and treat it. But here again we come back to our point that blood pressure depends on cardiac output and peripheral vascular resistance. Cardiac output depends on stroke volume and heart rate, and that is increased whenever there is a sympathetic overactivity. Now the second parameter is peripheral vascular resistance. Now to understand this term is very important. Peripheral vascular resistance means the resistance which is offered to the column of the blood when the blood column moves in the peripheral vessels. It cannot pass as such, because in the arterial system, if you look at the structure of the arterioles, there is a tunica intima, media and adventitia, and this media is a muscular layer and it offers a pressure. Okay, it offers, so the blood has to pass against this pressure. Okay, so here I have shown the arrow like this, but actually Actually, this column of the blood faces the pressure, so it should be like this. Okay? And more the resistance, it is very obvious that more the peripheral vascular resistance, the blood pressure will be more. Now I am asking you a very common example, that suppose this is a one tube. You just understand this is a tube, and water enters into this tube. Now when the pressure of this water column increases, there are two factors. If you increases the amount of the water that enters into the tube, obviously the pressure increases. Or if you constrict the tube, then again the pressure increases. Same applies in case of blood pressure. If the amount of the blood flow in the peripheral vascular system, it increases, the blood pressure increases. Now when the amount of the blood flow increases, when the cardiac output increases. When the cardiac output increases, when there is a sympathetic overactivity. That is one. And second is when the diameter of the vessel reduces. Okay. So whenever there is a vasoconstriction, whenever there is a reduced elasticity of the vessel wall, the blood pressure will raises. And dear friends, here I want to clarify you a very important point, and that is the compliance of the vessel wall, the flexibility of the vessel wall is inversely proportionate to the sodium content. It means that lesser the sodium, more will be the flexibility, and when the flexibility will be more, the peripheral vascular resistance reduces, and that's why the blood pressure reduces. Okay? So this is all about the reasons. Now what can be the possible target sites? The possible target sites stop.